Welcome to the seventh lecture, and I'm pleased to see so many people listening again. As speakers we have Annette Peters, Thomas Voss and Ralf Krolewski. We're going to introduce them separately, and also people from the Health for Future and Students for Future networks, Stefan, Hermine and Siglinde, who are going to make brief presentations at the end. It's a special moment because we're going to have the last three series, 7, 8 and 9, and the issue will be to give lots of examples for different kinds of transformative action from our fields and to maybe also derive some bright ideas for yourselves. They are different, but there are some links which you'll also see, and you'll also see that all the main fields of action are covered, but of course in every town, in every district or federal state, there will be different situations. Now let me also point out that in the 9th series we'll get lots of examples from your group. So there will be exclusively examples from Health for Future, KLUG, and from Students for Future. So if you have any ideas for that, please turn to Felix and contact at Planetary Health Academy DE for ideas, and then we'll see how we can cram them in. Maybe it's not possible to cram in everything, but it will be a lot, and we'll also have a big celebration. So then we would like to see you inviting lots and lots of people to that. We'll certainly have some special guests which will blow you over if you see who's coming. This is going to be a special event as the whole series has been special. Now with this I would like to introduce Annette Peters, and we've known each other for 1 year nearly, and last year at the Lancet Countdown we've worked together for Germany and again now, and over this time our mutual understanding for what we're doing has grown, and also the interest in putting the transformative perspective into other fields more and more. You are head of the Institute for Epidemiology at the Helmholtz Institute in Munich, and you are specialized in air pollutants, which is a big issue in Germany and worldwide. And this means also a big issue which you can use to show how you can change and how you must change the agenda. Also an example of co-benefits, because it shows if we exit fossil fuels, which we need to do anyway for climate protection reasons, this will lead to a situation where millions of people will have better health, millions of people each year will die less from these pollutants. So I'd like to pass the floor to you. Well, a very warm welcome from me. Now you can see a shattering picture of a Chinese mega city, and you can see that more than 7 million people worldwide are dying because of the fact that in 1 cubic centimeter of air there are tens of thousands of ultrafine particles which are released by combustion processes which coagulate in the air. They collect other pollutants on their surface, and this is what we breathe in deeply into the lung. These particles are then deposited in the alveoli, and they can trigger inflammatory reactions there. And if they are small enough, these ultrafine particles, which haven't been regulated about, they will also penetrate into the blood, so they will also cause inflammation in other areas. And it's been known for a long time that the respiratory tract and the lung are concerned by these air pollutants. It's now known that the heart, the brain, and also the metabolism are affected. The problem simply is that we can see the effects are rising in linear shape, even below the current emission thresholds, recommendations by the WHO. And if we look at Europe, we are talking about 25 micrograms per cubic meter, so this is far beyond this threshold. So it's something which we as scientists and in the scientific organizations, we keep communicating about this, keep motivating about it. So if you hear on the radio that we are on the safe side in Europe or in Germany, we are no particular problem in Germany. The reason simply is that the thresholds are simply incredibly high. You can also see these effects worldwide. These are short-term effects which are listed here. So previously we were talking about the long-term effect, which must not be exceeded over the course of 1 year. These are the values which mustn't be exceeded per day. And you can see that for fine particles, if you go beyond 260, if you look at 260 megacities globally, then even below the thresholds we have currently, there can still be health effects, negative health effects. The whole body is concerned, and we can also see that more and more diseases, such as infection, are triggered by air pollutants. And in times of corona, this may also be an interesting result, which we actually knew of before. Looking at Europe, for PM 2.5, you can see that for the large cities such as Paris, they are clearly affected, but also the Po Basin is much affected. If you think about soot particles, then the regions which otherwise look quite clean in Central and Southern Europe are affected. And if you look at NO2, which is much talked about in the course of the diesel discussion, then I can see each individual megacity looking at NO2, and also if you zoom into Germany, I can actually see the motorways. Taking a look at other countries, such as what happened during the corona epidemic, you can see this was a period when, obviously, if people stop their anthropogenic activity, then pollution will also go down drastically. You could say, well, then it's easy. What is the role of pollutants on the corona pandemic? Well, it's been known before that pollutants can interact with each other and can cause worsening of diseases such as pneumonia, which can be a cause of death. And we also know that people can become more vulnerable. More air pollution means more respiratory diseases and cardiovascular diseases. And the first analyses, which were also talked about in the press, suggested that Lombardy, for example, is so hard hit, northern Italy so hard hit by corona because of the air pollution, which is true. But if you go to the bottom of this scientifically, we must say that we don't have the data for that, we don't have the evidence for that. The pandemic also has its own dynamism. So it's very difficult to find explanation for everything. But what's more important to me is that during the lockdown, as citizens and also for patients, we've been able to see what it means to have clean air available and also to have more silent cities. And this is something which is beneficial. And this is something we need to also communicate about, because this is a real-life experiment which is being carried out, which is of huge importance. And the pandemic also has shown to us how connected we all are, and how it is possible, if the will is there, to make a change. And we should also quantify this and talk about it and use it for new ideas for the future. Here we can see the co-benefits. Where would life years be gained if you could implement climate goals effectively and quickly, especially if you do decarbonization more quickly? Then you can see in Europe there would be huge positive effects, but also huge benefits on the Indian subcontinent, also in China or in Africa. This would be the areas where the biggest gains would happen. And This link between the climate change and anthropogenic sources of particles is something which must be looked at in context. And on the one hand, we need joint modeling. We need to understand the mechanisms of action and also the effects on health in general. We need to quantify these effects. So my point of view is healthy air can save lives, clean air save lives, and it also has a positive effect on overall health. Of course, we're doing detailed research on that, but we also keep talking about our results in order to improve the environment as a long term. Thank you very much. Thank you very much, Annette. I think you've been the first speaker who's not used her or his time budget, but this gives us more time for discussion later on. So I'd like to pass the floor to Sylvia, who is going to introduce Ralf, and then we'll discuss both of your presentations. Thank you very much, Martin. Ralf, we're very pleased to have you around again. You've been active for climate protection for a long time, also active within KLUG. You could say you are a veteran of KLUG, and you are a general practitioner in Gummersbach, and you are working hard for climate protection, and you also have a climate surgery. And we're very happy to see you today. You'll explain to us what this means and how you implement your vision of climate protection locally. Thank you very much. And welcome to our climate surgery. I would like to introduce myself. I'm active in Gummersbach, place in North Rhine-Westphalia, and you can see me in front of my practice at the left. And this is a journey which started at this GP practice with discussion about the Sustainability Agenda 2030. Then at the World Climate Conference and the WHO events, I've represented my area as rapporteur, and I've got to know essential people who have really changed me, and I would like to thank a few people in this context, because this exchange and discussion has led to the concept which I'd like to introduce. So these, of course, are the KLUG people from the Planetary Health Alliance, who I got to know. Also Sylvia, we met in Katowice for the first time. I was the only doctor from Germany, and you were medical students, and this was very inspiring. We were 60 people, and we had more than 600 in Madrid. I also would like to thank for the inspiration to the Global Family Doctors, that's our world organization. I'm working with colleagues from Brazil, Canada, the Pacific region, all continents basically. I also like to mention great people who are working globally. Christiana Figueres, for example. Without this active woman and UN diplomat, the Paris Agreement would not have been possible. It's crazy to see how much she's doing. And the Wayfinders, so these, they represent old knowledge. They come from indigenous people, and they also appear and speak at the WHO conferences, the climate conferences, François Paulette and Kesara, and many others from the Amazon area, which is under threat. I would like to mention these names because they are crucial to me and gave me inspiration for my concept, which I'd like to talk about. You can see that this is the place on our planet where I live and work. And the climate surgery is based on a basic viewpoint on planetary health in our work with patients, and it's about behavior, perception, and communication, where you can see the arrow. This is my practice. And in this area, I'm moving around with my electric bike on 100 square kilometers on my home visits, and I sometimes carry this device, which is a particulate measurement device I would like to pick up from my preceding speakers. So on my bike, I measure the particulate concentrations at crossroads, for example, and we get sometimes values up to 35 micrograms per cubic meter, depending on the traffic. And sometimes we have poor weather conditions, no wind basically, and also if you add the fireplaces and their emissions at wintertime, the values rise. In New Year's Eve, you can go up to 800 micrograms per cubic meter. If this would continue, this would not be compatible with healthy life. In this case, you would have to evacuate the whole area. This is a place I sometimes go to. It's a care home. I go there with my electric bike, and the travel time is 8 minutes, because sometimes car drivers overestimate their speed. I'm also very quick, and I know all the roads and small paths, and so I'm also a wayfinder, and we also fight for a healthy cycle network in this region. Get me back to the work with patients. What is the ecological footprint of a practice? And this is a slide I drew up together with Rainer Sauerborn, and we made a presentation to the Chamber of Doctors in our region about health, climate change and health. A practice has quite a considerable ecological footprint. And if we do not transform the health system, then we will miss out on the goals of the Paris Agreement. So irrespective of energy conversion and so on, I would like to focus on my work with the patients. In Germany, people normally go to their doctors 18 times a year on average. So you have got lots of possible contacts, and they come because of diseases or prevent or screening. And so we have a huge option to talk to people and have contacts with people, and this could be a good basis to work with my patients. So I've got a GP practice, and my team and myself, we have more than 200 patient contacts a week. So how can we work with them to achieve planetary health? If we look at our average personal ecological footprint in Germany, we are quite high. According to official data, we're talking about 10.6 tons of carbon emissions per year. Of course, China is a bigger country, but China only has an emission of 7.2 tons, India 1.6 tons, so Germany has 10 times that nearly. And when we look at the individual footprint, the breakdown of that food, consumption and mobility have a huge role. If you come to my practice, of course, you'll find flyers, things which we have available there. So my practice is recognizable as a practice with this goal. So when there are questions, we always give answers. But what happens during the surgery? What is possible to do within the general practice? This brings me to the basic starting points. So if you have a focus on planetary health, you first should know something. As always, when you have a contact with patients, it's important to be interested in the patients, to take the patient history. That's very important. But what are the living circumstances? What is people's diets? How do they exercise? What is the social situation? And of course, you always have these opportunities of asking these questions through patient contacts. And patients have their own interests, which I sometimes ask about. Sometimes they are hidden, and they don't really speak up are not very outspoken about that. But the important thing is for us to find out what are the main factors which drives people, and it's not enough just to ask about ICD-10 diagnoses. So it's a process which happens between doctors and patients. Most patients are open and about the topic, because when I talk about planetary health, they are interested in that. As far as it relates to health, diet and healthy exercise, but there are always some doubts about what a healthy diet actually constitutes, what it actually is. I've got an interesting situation at the moment, the COVID situation, and the fact that in 2 counties, 640,000 inhabitants are hit by a lockdown because of an outbreak of COVID. and in the context of a meat processing plant called Tönnies, and it boasts that they have a T30 plan for a healthy diet. But the working conditions there bring it home to us what the system is like there and what crazy health risks are caused there. This is also a subject of my surgery. People raise about these. This is subject when we talk about diet. The central messages in the climate surgery is about the lifestyle and non-medicinal aspects. And they decide about health and well-being, and lifestyle and non-medicinal processes are more decisive than medicinal interventions. The state of the environment and the climate has an impact on our health, and by changing our behaviors we can achieve better health and we protect our livelihoods. So it doesn't make sense to have a top-down approach. You need to think from this from the patient's point of view. The goals of interventions, reflections, and motivations are to create an interest for a low-carbon lifestyle. You can translate this as living without coal. I come from the rural area, which is very much characterized by coal and steel mining. And I still remember the terrible air pollution, which meant that sometimes traffic had to be stopped altogether, such as in 1982, because the hospitals were full of stroke patients and heart attack patients. So I came up with this term, living without carbon, but in German it's a pun also, living without money. So it's challenging the consumption behavior. The possible contents of this conversation with the patient is planetary diet, materials of the Federal Center for Diet, then sources which are evidence-based on active transport, mobility, regenerative energies, reflections about the ecological footprint, and also divestment. But this wasn't really so far the big topic in the climate surgery. Per week I'm carrying out at least 10 of these interventions on the occasion of screening exams, checkups, and I can achieve 1,000 such interventions per year. The changes which I can achieve can produce a cultural revolution in your personal lifestyle. Today I had a more than 70-year-old pensioner who is changing tack because she's identifying now with Greta Thunberg, but this requires communicative competence and social skills. And what I find in these discussions, then there are more people actually motivated and concerned than you would think. The climate surgery is based on relationship, perception, and communication. It can be carried out anywhere without a technical infrastructure. It is embedded in the patient-doctor contact. It's very much alive, and it's all about encounter. It's based on values, respects the autonomy of patients, and works on the basis of 10 principles for planetary health based on the Canmore Declaration. And the Canmore Declaration can be found in the annex of this Planetary Health Alliance or Academy, especially principle number 4, which is narrative health. So how shall we talk about health? What kind of stories can we tell? What is perception? Which words will we pick in the interactive work with patients? I understand myself as a medical companion and motivator. Of course, I can only do so credibly if I really live by this principle. So how do I eat? How do I move? How do I exercise, as I mentioned? So I can only be credible if I live these principles actively. And from the field of medical communication and psychotherapy, there are some basic intervention techniques of reinforcement, motivation, positive reframing. These can be very effective, and they can also be used in short interventions. Now, I would like to give you some case stories, because that's always interesting, I find. This is the reference to the EAT Lancet Commission. We can see Walter Willett and Romström who show it to the press. It's a worldwide initiative. the EAT Lancet Commission hasn't really found a good rate response in Germany, but in many other countries it has. The Canadians have come up with a diet recommendation, but very positively. They don't say meat is bad. They simply support the motivation for a plant-based diet, and can also introduce a 64-year-old coronary patient who came to me after a heart infarct, and he tries to eat healthily. Pravastatin attacks the muscles, which is quite a frequent side effect. I'm eating more fish than meat, and also ate onions and ginger and garlic. My neighbor also experiments with these things. Can you tell me what is healthy? That is, of course, a great starting point for an intervention. And then I will introduce the 5 rules of healthy diet by Bas Kast, a journalist who has won a prize in Germany in 2019 for a book with dietary recommendations. And I encourage him to take this seriously and then come back next time. So I do some reinforcement with motivation, and then also make a brief remark. It's good for the heart. A 56-year-old overweight patient with knee pain and mild diabetes. So that's a typical situation. He wants to reduce his weight and asks about healthy diet. Well, because of his disease, this person is very motivated, and the medical intervention in favor of plant-based diet, that's a crucial thing. Adaptation and motivation. This was a 45-year-old. He lost his driving license because of consumption of cannabis and alcohol, and there was an abstinence control program. And he came to me, and I asked him, how about living without a driving license? He says, it's not too bad. I'm doing retraining and also can reach my apprenticeship on foot, and later on I will try and find a job without having to drive. So these things can work, and you can reinforce a positive motivation in your surgery. I would like to also present a patient about the change potential, because there is big ambivalence in society. Society says these goals are too ambitious and we can't achieve them. But sometimes I admire patients who have a huge change potential. This is a patient where you used to say he has a very poor prognosis, polytoxicomania, relapses into alcohol consumption, but in 2012 he started on a substitution program. He's given up alcohol, he's married with kids, he lives with simple circumstances, but he's highly motivated via the medical doctors, and he wants to change, and he's undergoing a great change. And he then asks questions which also concern his family situation, and he has experienced disasters which motivate him, and he's got this goal of buying electric bikes. He already saved up 400 euros, and he has a dream. He wants to take a trip to Cologne and then on to Belgium, and a private credit has made this possible now. He now wants to go on a pilgrimage from here to Santiago de Compostela in Spain. So this is also a great example at the end for my climate surgery. I've got 50 of these cases which are listed, and everyone who comes to me gets a written recommendation where I put everything in writing. I try to put people on a healthy path for their lives. With this, I would like to close my presentation. I think it's an exciting journey for me, making new experience, and I'm completely motivated to carry on in this way. Thank you very much indeed. Thank you very much, Ralf. And today we're going to have the discussion after these first 2 presentations, which show the power of co-benefits. So what is going to change if we take climate protection seriously in the context of health protection? So we're going to take questions now on the presentations by Dr. Peters and Ralf. Lisa, do we have any questions? Oh yes, we have a few questions. The first one would go to Annette Peters. it was what the main source of the ultrafine particles in Europe and Asia are. And many questions also ask themselves about the link between COVID-19 and particles. Maybe you can say a few words on that. Well, in general, for fine particles, there are lots of sources. Mainly, it's combustion processes, which on the one hand emit primary particles, so soot cores, into the air. And these are the ultrafine particles, but these particles can grow and accumulate gases and other, for example, organic components, such as residues from, for example, diesel or petrol engines emissions, and they can also be resuspended dust. These can be pollen fragments and so on. So you can have a huge mix. And as the sources in inner cities, we have car traffic, but also heating systems, our smokestacks, our chimneys, our oil and gas heating, but also industry. In Europe, we have very high smokestacks, but if we have industrial plants, then sometimes there's particles coming out of other places, apart from smokestacks, and also the pollutants distributed from the high smokestacks are distributed across Europe. That's why we have this debate about the coal-fired power plants. That's great, thank you. And there was another question to Ralf. I think this was coming from colleagues, because people ask themselves how about financing, because this conversation with the patient seems to take a long time. And then also, are there training programs for people who want to offer such climate surgeries? Well, it's my basic point of view with which I run my practice. So I spend the same time amount as before. But these standard interventions, I'm doing that in the pre-screening and screening tests, and there is a financeable service which we can get reimbursed. And also you can mention risk factors for health preventively, and we should also, by our instructions, give recommendations. This can be done in writing by forms which are printed. So it's my normal medical activity or doctor's activity. I expanded this slightly. I have no disadvantages because of time for that, because I'm interactive. With this, my basic conviction, and a normal intervention will take 20 to 25 minutes. I also give some written recommendations, risk calculations, and I have follow-up tasks, but there are always some follow-up tasks because I'm active as a general practitioner. Lisa, maybe you can say something else. Together with Ralf and others, we are planning to do further training courses for GPs, because there must be a strong need for that. There's also reflection to do trainings on air pollutants and other things, which Ralf has mentioned, to make this as a focus subject of the policy brief for Germany, and to put it back on the agenda, very much in the focus of the agenda. Another question, if time's enough, to Ralf, because in your practice you get lots of different people, young people, old people. What's your experience? Is it easier to reach out to young people Is it more difficult to reach out to young people, or is it more difficult to reach out to old people because they are part of the vulnerable group, but they find it harder to change their living conditions, and the young people don't really suffer from conditions? Well, I don't have just young and old, but I also have patients from 55 countries. Via the refugees, we've got 10 more countries, and so we use multiple languages, which is a challenge here. But I can say that young people are more interested in dietary questions. The older ones are interested, if they have health problems, in diet questions. But the more difficult question is mobility. These are also the results of a study by Alina Herrmann and Rainer Sauerborn. They say the perception of climate threats are there. People are willing to change their diet. more, and we also are undergoing a Fukushima event in the form of the meat scandal in Germany. In the context of Corona, this is now drawn out into the public, which is good, but mobility, changing mobility behavior is more difficult, and really it requires local politicians' activities, mobility networks which should be accepted by people, so people should leave their car in the parking space. Of course, you can see this huge success of the bicycle industry now. The bicycle paths are overcrowded, but if you want to change people's everyday behavior the same way as Copenhagen and Amsterdam has done, we need more political activities, and doctors should also get involved there. I also have a question to you, Annette. You are working as a scientist mainly, and then you, of course, are in contact with KLUG and Health for Future, but also Ralph's examples. But why, from your point of view, is it so important to have this network and for us to cooperate between science and society at large and students? What is special about this? Well, from my point of view, it is a continuum. There are things. Well, I myself as a scientist think it is good for me to keep on the objective side of things, because then you can reach out to many different groups. On the other hand, I find it extremely important to also have citizens, campaign groups, NGOs who can say things where I find it more difficult as a scientist, because if I'm asked, well, Dr. Peters, do you have any data on that? I would have to say, no, I don't, but I think it's important. So, as an active citizen, you are allowed more freedoms in terms of your statements. And what you are doing, Mr. Krolewski, is, of course, extremely inspiring. We as scientists have written similar briefs for cardiologists about air pollution, what they should tell their patients. And I think it's extremely motivating, because you are actually doing things. You are putting things into practice. And is things into practice which everyone can do, every citizen, but also you as a doctor, because you have more direct contact with patients than I do if I present my figures and my relative risks data. But I think it is one continuum between us, and it inspires. These examples inspire us. Also, the questions which are asked can be very encouraging. They're inspiring to scientists. And this question of transformation research, so what do we have to initiate and do we have to substantiate in order to achieve change? And what will work in order to make people change, and what won't work? This is a new question in science, a new discipline in science. It is interdisciplinary, and of course, everything depends on your conception of science. At the Helmholtz Center, we are working on molecular levels very much, and that's extremely specific. But, so to speak, we have to create a new drug to make this relevant, and in epidemiology, it is relevant as a subject, but the big social processes and research are even more relevant because they really change our lives. What I find very interesting, Annette, in you is that increasingly you regard your science as a transformational approach, but you stick with science. In Ralph, you can see these examples of micro-transformation. Ralph, from your point of view, you think every intervention or every consultation has the potential for micro-transformation. And if you say, if I reach out to thousands of people over years, this constitutes a huge transformative potential. And also you summarize these examples and you act at the local level with politicians, and also you are globally connected. And the third example of transformative action is because our joint work, there is a connection with people like Ralf and people like you, Annette, and this influences each other. So creating this network where people are in different places, but still they work in the same direction, similar direction, and they get the food for thought from each other. I think that's a crucial thing. It's also an invitation for today and also for the next 2 days to broaden our imagination about where transformation can happen, and to see that there are many places, many points, everyone in their life contexts have windows of opportunity, such as Ralf has in his work with his patients, where microtransformation can happen. And this comes out from these discussions. Big transformations are just the sum total of many micro transformations. There won't be a big bang. Things will happen in a multifaceted and differentiated way. Ralf, before we move on, do you want to say 2 or 3 sentences? Well, I would like to respond to Annette Peters. In Gummersbach, we are planning a citizens project, which means giving particles measurement devices to 8 different locations. I'll organize that, and the data analysis is going to work with the University of Cologne with 8 PhD students who will analyze the data, and it's a citizens project working with the university. So I like to work with these interfaces because we can really make a difference there. That's fantastic. At the end of this session, we'll have a discussion with everyone, and maybe you make a contribution then. Okay. Now I would like to introduce Thomas Voss, who is the commercial director of the LWL Psychiatric Hospitals in Münster. We got to know each other in January. He made a presentation at a congress, which was very impressive to me, about transforming health psychiatric hospitals he's responsible for in the last 20 years. And he's going to tell us his story. Now, the floor is yours. Right. I hope you can hear me. Excellent. So thank you for the invitation. I'm really enthusiastic. There are nearly 900 viewers. And I would like to show you what we are doing in the last few years in the hospitals in Lengerich and Münster. And as we've just heard, these are 2 hospitals for psychiatry, 2 specialized places. At both locations there is also a care home, and on both locations there are residential facilities for psychiatrically impaired people, and there's also an institution for addiction. So per location we have more than 1,000 employees, an annual revenue of 85 million euros and per location, and there are no subsidies, tax subsidies. LWL, that's the association, the regional association of Westfalen-Lippe, and we have the instruction not to get money from the municipalities. We need to generate our expenses from our own resources and revenue. And we've been looking at sustainability and environmental protection for a long time, for 10 years. We are in the Allianz for Climate Protection in Münster, including the city's companies about decarbonization. We are involved in an exhibition project. We use fair trade products to a limited extent, to a much higher extent. We're using organic, or bio as we call them, products. I'll return to that. We are validated under EMAS, which is environmental management. I'll say more on that. And the Lengerich Hospital has been awarded, or certified rather, under Eco-Profit in 2004-2008. We have for 9 months now been involved in the Diet Council of Münster, which supports regional food supply, and I'm also involved in the strategy for organic agriculture, which is a project funded by the Federal Agriculture Ministry. We are also involved in the initiative to promote organic food in public institutions, which is a result from the future strategy for ecological agriculture. I'd like to give you 2 or 3 sentences about social matters. Since 2010, we have been certified under the scheme Beruf und Familie, which is job and family. We have got creches in both places for below 3-year-olds, and in Lengerich, which is close to the Lower Saxon border, there is a summer camp for our staff's kids, so staff can hand in their kids in the morning and pick them up in the evening after a great entertainment program. And for 2 years now, we also have a winter camp, which our kids are enjoying very much. About EMAS, many will not know it. If you ask someone in the street, do you know something about EMAS, everyone will really be at a loss for words. And EMAS stands for Eco-Management and Audit Scheme. It is an environmental management system run by the European Union. It is the most ambitious environmental management system globally, also includes ISO 14001, and we've been validated in 1999. And Lengerich since 2011, and it's a kind of QM system, and it forces you to do a permanent plan, do, check, act process you have to continuously develop. So between 1982 and 1999, before the EMAS validation, we have implemented 20 environmental goals in these hospitals at least, and since then, since 2000 to now, 180 environmental goals. This includes small steps, but also big, ambitious things. And I'd like to give you a few examples of those. Of course, I could fill the whole evening with our examples, but just give you a few things. There is a plant nursery in Münster, and we have started collecting the rainwater for the nursery. The nursery is there for therapeutic purposes, and the complete rainwater is used for irrigation. This was the idea by our gardeners. And since 2002, we've had the first solar power plant, and we generated our own solar energy. We have a new building which was commissioned last year, and there is a big solar power plant on top of it now for our own energy demand, so we're able, using both solar plants, to cover 60% of our electrical baseload with our own solar power. And it was quite difficult, but we have managed to use 100% recycling paper in both companies, in both hospitals. If you know about this, then you will realize that at least at the head doctor or the director's level, there is a lot of resistance, but we have convinced all of these levels, even the board level. There's no fresh paper anymore. We're using 2 used electric cars, which have proven their worth, tried and tested. We're going to convert 2 other cars this year from combustion to electric, because these vehicles are driving around on the grounds of our premises and also in the city. In both hospitals, we promote cycling. You will know that Münster is a place where a lot of cycling is going on. We have 250 company bicycles. You can see our staff in the technical department. They also only use bicycles for their trips. And also we have load-carrying bicycles, so it's easy to carry a dryer or a washing machine using this bicycle. It's very popular with the craftspeople and the builders we have. And we have several buildings in Münster which we covered with so-called Klimalife tiles. So when it came to renovating the roofs, we have opted in favor of titanium dioxide coated tiles, and this titanium dioxide coating splits up the nitrous oxides, and so mathematically speaking, we can eliminate the nitrogen dioxide emission of our company cars in Münster, and the effectiveness of these tiles has been confirmed to us by the German Federal Agency for the Environment. For 10 years now, in all wards and all levels, we have energy coordinators. They are the ones who chase after wastage. You will know that sometimes people have the windows open at winter time and keep the heating running, and you have a meeting but the computers are carrying on, switched on. And then these energy coordinators will speak to their colleagues and try to teach environmentally friendly behavior. For 5 years at all the conferences and meetings, all we serve is tap water, not mineral water, which is carried along large distances. And this response is very good, and increasingly we also not using mineral water at the wards, rather using water coolers. And something which is also very good is jubilee trees. There are 2 big parks around the 2 hospitals, and people who've been around working for 25 years or 40 years, we've been planting jubilee trees for them, but it must be a native species of tree which expresses our valuation or appreciation of the employees. By the way, people now say, walking through the park, this is my chestnut tree. This response is very good, and of course it's also good for the park. For a few years now we're offering places for voluntary service for the environment, for young people, for 1 year, and we try to communicate the idea of ecological behavior in both hospitals. We have renatured large areas, we've got wildflower meadows, and we're trying to make sure that we support insects and bees especially. We are especially proud of the idea of the topic of food. In both hospitals we're using more than 22% organic products, which is quite a lot for a hospital. We try to make sure that the cooking is fresh. We're also a member of the Münster initiative, Münster Eats Vegetarian. So every day you can get a very good vegetarian dish. And in 2010 we decided to introduce vegetarian Wednesdays, not Thursdays. There are reasons for that, but this would take us too far. This is picked up quite positively. We can see increasingly a trend for plant-based diets, vegetarian diets, and the demand for vegan products is rising. We've got lots of regional suppliers. We're quite proud of that, both in the conventional and the organic spheres. This is an egg producer, and 50 kilometers away from us we have a poultry farm, and we try to make sure that this farm respects animal welfare and uses old species, native species. We have a supplier who delivers pork to us, and both of these farms have converted to organic pork. At the time it was because of the MRSA problem, and now for 1 year we are increasingly using organic cattle as a beef source. Also we use the whole animal, and apart from the wholesale suppliers, and every hospital has a wholesale supplier, we also have 2 organic suppliers locally, and we try to work with them increasingly and favor them. And when it comes to fresh milk, we use a small family-based dairy farm with its own dairy, so the distances are very short and you can have personal contact with the farmer. We are also proud of having our own plant nursery. In the old days it just produced flowers, decorative flowers for our hospitals, but one of these greenhouses now is reserved for the production of tomatoes and fresh herbs, also in the context of ergotherapy. So this ends up in the kitchen, and great tomato sauces are produced from those tomatoes, but the patients see that everything from ergotherapy to lunch to their lunch, they see the context or the link between this, and this has really been very popular. Of course, we ask ourselves, you should ask ourselves how we fund ourselves, and we also try to reduce food wastage. In the last few years, between 2013 and 2018, we've been able to cut our food waste drastically. This has also meant that we have received an award for that. We are saving 35 to 38,000 euros through this anti-waste campaign, and it was clear that this money saved will stick within the kitchen and they can buy more expensive produce. The Lengerich hospital has its own orchards, and the apples are collected in the autumn, and as far as we know, we are the only hospital in Germany using or producing certified organic apple juice. We have a press meeting in the autumn each year, and we invite the general public, which is important because the revenue from the sales of this apple juice goes into the maintenance of these orchards 100%. All this gives us a lot of positive press. We're quite well known in technical magazines, medical magazines, hospital magazines. And something which is even more pleasing to me is that we get lots of positive coverage in the local media, which is not easy for psychiatric hospitals because there is still a lot of stigma connected to it. And therefore, we have got a very good reputation also as an employer. So if you want to summarize this, we have been certified as a CSR company for the Münsterland. And my experience is if you want to make a change, the time for that is now. I'm sure that through Corona, we're going to be given another push. The meat processing industry, the slaughtering companies have been mentioned before. I think we are going to see some rethink now, since politicians have stuck their heads in the sand for many decades. Everyone responsible, no matter where they stand and where they are responsible. Everyone can do something. I think everyone has to do something. And also my experience in more than 20 years is that more is possible than you would think. You start with the first step, but it's always possible to go one step more, to take one step more. And I also think that there was a lot of discussion about in Germany typically of why things cannot be done, why it's not possible, why it's too difficult, but you have to keep going. You have to be resilient to frustration because that happens and everyone knows that. But please be bold. My experience again is that everyone can be converted, maybe sooner, maybe later, and at some point everyone will smart and be wise to it, and then we have a special responsibility as hospitals for society. But my experience is you need to want it, and this is the picture of our art therapist together with our nursery. So thank you for listening. Thank you very much, Mr. Voss. And I think, Sylvia, you're going to introduce the next speakers. Well, it's very fitting after your presentation, Mr. Voss. Next, we have Stefan and Felina, and they are both students from Hannover, from Students for Future, and you are going to tell us something about sustainability in the hospital or in buildings. Who's going to start us off? I'm going to start you off, and here's my presentation. So we are working with Students for Future in Hannover, but we're closely connected. We also have contacts with Health for Future in Hannover, and we're cooperating with Fridays for Future. So everyone is in the same boat in Hannover. And in Hannover, we have a big medical university which needs to be rebuilt. We've brought the picture, and you can see why there has to be a new build. The old building is 1970s, and nothing has been renovated. It has to be built from scratch, and I think it's a good time now to make sure that this new build will be climate neutral. So what is the with you. The Medical University of Hannover is a university hospital. It is very big in the region. It is going to be built new in 2022. The current cost estimate is 1.5 billion euros with a rising trend. Whether this will be possible after Corona is now an open question, but we assume it has to be built from scratch, and it's going to be built with 1,604 beds. And as you will know, means it's a very big place, then a big hospital with 15% intensive care beds and 178,000 square meters. Now, climate neutral buildings, why? What some people will not know is that buildings, in buildings, a lot of energy is used for heating. So the energy requirement in buildings, or 2/3 of that in Germany, requires energy. The energy required goes to spatial heating. So we're talking very big quantities of energy, the same more with electricity, and this is only possible if I insulate these buildings a lot, and I can only insulate efficiently if I have a new build. For refurbished buildings, it's more complicated. So when the chances are of building something from scratch, then there should be good insulation in order to achieve climate neutral buildings, which we need to achieve our climate goals. So our demand is therefore that the new build should be climate neutral. Thank you very much. So far for the background information and theoretical information. Now my topic is going to be what we in Hannover rather have done as a group in the past and what the plan is for the future. And I would like to start with what we did last. Everything started last year in August. We started putting forward our demands to the medical university, and among others we mentioned the new build, and we demand that this should be a passive building, so it should be climate neutral. And in October our demand was carried by more than 600 students in the students' assembly. So we then handed this demand over to the president of the university, but in the discussion with the president, it turned out that the president regards himself as not in charge, and he passes the buck basically to the federal state of Lower Saxony, which is in charge. And that's why this route, going via the president of the university, was to no avail. We also wrote off to the Prime Minister of Lower Saxony and put forward our demand there, again, to make sure that the new building of the medical university should be a climate neutral building. And the answer was, first of all, very evasive. This was very sobering, but we also made contact to local climate protection agency, also the Chamber of Architects locally, in order to start talking to experts about energy efficiency standards and different types of buildings and what is possible in terms of the building technology and what is also recommendable for climate neutrality. And in the context of a discussion, we were given the tip that it would make sense to also make a request to the local politicians, and we did so. We asked the city of Hannover, city council, as to what they think they should do as a city which has this medical university. Can the city influence the way the new building is going to be built? But again, the answer we got back was they don't feel responsible. They think the whole responsibility lies with the federal state of Lower Saxony. We also made contact with the Environment Ministry of the federal state, and the first results of that discussion was positive, and we have the feeling that within this ministry there are some activities of the ministry itself which helps us in our message. And this brings us to the present. At the moment we are writing letters to the 3 ministries involved when it comes to the new building, which is the Ministry for Science and Culture, because that's the ministry which is responsible for university buildings. So automatically also for the new build of the medical university. We also are writing a letter to the Ministry for Finance and the Ministry for the Environment in order to highlight our demands and put our demands on the political agenda. In the further course of events, we're going to talk to the general contractor for the new building in order to make the topic present in people's minds, that it becomes clear that climate neutrality has to be thought about now as we speak in the planning stage, because you can only achieve climate neutrality if you start from scratch, and it's not possible to refurbish a building and make it climate neutral in that way. And we keep it open whether we're going to just talk to the experts who are informed there, or whether we'll also talk to the decision makers and what the discussions will look like. That's not quite clear yet, but so much for an outlook to this. And what's also a possibility we see is to use, or to also use the help of opposition politicians, putting our demand forward into the state parliament in order to underline our demands. So much for an overview. I would like to close with what we have learned from the whole process in the last 6 months or 9 months. And we've heard some of these ideas before. We've learned that political structures are very inert and very complex, and we need to go into it it's a long haul. We need to bring the urgency home to the people who are in charge, and this requires lots of discussions, good connection between experts in terms of energy efficiency and building construction, also with those who are decision makers and also the agencies and authorities responsible. And I think we regard ourselves as the people who provide connections or make connections possible. What surprised us was that you have to write letters to the ministries instead of emails, in particular if you want to get an answer back. This could be interesting for some of you, that in this case you have to write real letters, traditional letters, and we can notice that we are getting the ball rolling now, but we need to do more work persuading people to make sure that this building will be climate neutral, so that the medical university can make a contribution. Thank you very much. A great example of how you are trying to tackle really big projects and learning as you go along. Great example. I'm sure there are lots of examples in other cities, and if we get connected, we'll learn from each other much better. So that's great. I was very moved by this story, and also we discussed that we would invite you immediately. That's why you're here. So I'd like to pass the floor to Siglinde. That's a completely different perspective now. Siglinde Hechenpichler, we've known each other for 1 year. She went to this 1-week course, which is a precursor to the lecture series of Planetary Health. You are a Brazilian, but you've been living in Honduras for a long time, and you're doing your master's thesis in health sciences, but you're a doctor, and I invited you to report to us about the Honduran situation and what you can tell us from the Honduran perspective for our activities. Siglinde, you were going to speak English because it's easier for you for some technical terms, and later on in the discussion we can have it in German because you understand German very well. But you wanted to speak English. Okay.
Okay. Hi, everybody in the Planetary Health Academy. I will be talking about a little bit of what the situation in Honduras is. Honduras, first of all, is in Central America. It's a really small country. We're only about 9 million citizens. And as Martin already said, I was part of the workshop last year at the LMU for Transformative Change. And we were working on a proposal in doing, for example, climate resilient health systems in these small countries, lower income countries, based on the Sustainable Development Goals, SDG 13 and SDG 3. And also with help of the European Union, we are doing the first assessment for the climate resilient health system. And what I really wanted to share with you is Honduras is in a really particular situation. We are climate zero zone for climate change in America right now. We have 70% of poverty. 5 years ago, it was only 45, but right now it's 70%. And as many of you might know or read the news, we have a humanitarian crisis right now, where there are migrant caravans going to the United States, fleeing climate change, basically. So yeah, we're having an economic and social upheaval. And what I really wanted to stress out is the perspective for Honduras is really bad. By 2050, most scientists say we will no longer exist as a nation. The economy and the social structure will also come down, and we will be facing a humanitarian crisis. What is important to me is to stress what activism in countries such as in France and Germany and the United States, why there needs to be strong activism and political will for more climate neutral economies, is that we don't have much time, as you guys do. You have timeline that says, okay, in 2080, in 2100, we are going to be facing this. But for us, 2050 is our end. So what I really wanted to stress is, I really appreciate all the work all of you have done. I'm really, really surprised of all the advances you've had in Germany, but I also want we can improve in lower income countries such as Honduras and also in Brazil. So thank you.
And I think now we can go to the discussion part.
Maybe Lisa, if she had any questions for...
The questions on Thomas Voss's presentation or the other presentations, Lisa? Well, lots of questions, lots of praise also. People are inspired by the Münster example, certainly. And the first question was, who organizes this? Which departments are involved? How big is the team? And is there exchange between different hospitals? Because this project could be an inspiration for many institutions in Germany. Right, how big is the team? Everything started in 1998 with 2 people. That was me. I was head of department, and a colleague who was responsible for environmental management. But you, of course, can't run it as a 2-person show. So now, in both hospitals, we have a working group on the environment with interested parties, 10 to 12 people each, from all professions. We also have doctors in them, which I'm very pleased about. And, well, if you keep your eyes open, and then there are lots of people in the workforce of a hospital who you can inspire and make contribute. This was a bit, well, it was slow in the beginning. You need to have stamina, but you can move a lot. The mere fact that I'm here today shows you that I'm also a kind of ambassador. Otherwise, Mr. Herrmann wouldn't have known me. And I tried to talk to as many possible colleagues from other institutions as possible. When it comes to the managing directors, it's difficult because in the last 2 decades, hospitals have been reduced to the idea of economy, making economies. People who are in charge in hospitals are not the doctors, but normally they are the economists who are at the top of these things. And they always ask the question, what does it cost? So to give you a very small example, when it comes to food in the hospital, we have a limited budget per day, €5.30 per patient and day, which is more than other hospitals, but it's really kind of minimum income level. But there are some other hospitals which work on levels of €2.80 or €3.20 per day per person in terms of the groceries. And I always tell people the grocery cost in a hospital is only 2% of the total cost. So you will not break a hospital financially if you increase the budget for food. So I'm always happy to be an ambassador, and the hospital associations in North Rhine-Westphalia, our federal state, also have adopted this idea. There is an environmental working group of all the hospitals in the state. So there are some changes going on, and there is progress. And when it comes to the magazine management in hospitals, there was also an article about food waste. So slowly but surely things are moving in the right direction, and hospitals have a special social mandate, and if you don't face up to these issues, you will have serious problems in the next few years. And in November, there will be the first Congress on Sustainability in Hospitals in Germany. Maybe Mr. Voss will be invited. We are invited. So there are things moving. But unless we put pressure on many places, then there will be no progress fast enough. There is also interest in the audience as to how you can bring up the pressure in a clinic, what your examples are, what the transformative processes are, which are easier to trigger, and who are the best people to talk to. Well, this is difficult to answer because it has not the standard hospital. We're talking about different systems, different regions, and also contact persons with different mentalities. There is no one solution, magic solution, but you should get started. Try and find your allies. That's always a good idea. And once you've started, you'll find these allies also on the top levels of administration in hospitals. It's difficult if you start from the grassroots only, but there is support from the grassroots, but you also need allies in the higher echelons of management in hospitals. You have to try and find them, but you will, I'm sure. How important do you think these labels are, which exist from environmental associations? This is an energy-saving hospital, for example. Well, I think they are good, these labels. I am not a fan of all too many certificates. Of course, we've got these certificates, as you've seen previously, but the best thing to do is have certificates which you don't get once off, but which are continuous. For example, the EMAS evaluation, EMAS, there is an independent server coming in, an expert, and validates you. So you're then under pressure to improve constantly, which I find very helpful. And I think these labels are ideal and certificates because you improve your chances to speak to the general public, to have press coverage. I'm always in favor of doing good and talking about it, trying to motivate people to get engaged. And for this, you need labels. Just to give you a brief example, if once you have a certain awareness level, then word will spread. Before Corona started, there was Bavarian television team here rolling a documentary about more organic food for Bavaria. You can take a look at that at the Mediathek. We were the only non-Bavarians in this documentary. And of course, this relates to our organic certification, and these are things which, of course, make our staff proud. The kitchen staff, they are all extremely proud. They were glued to the screens and told their families, this is where I'm working, so I'm proud. And just a brief remark about the question, how you also put managing directors into the boat. Of course, there is a big competition ongoing in Münster between hospitals. We have 9 hospitals in this region, and because of the fact that we are credible, looking after the environment and social affairs, and also have a good reputation there, this gives us an advantage in the labor market. over other competitors in the health sector. Especially young people, they apply to us because they have inform themselves prior to applying to us, and they are in favor of us. These are other questions to Feline and Stefan, or Siglinde. To Siglinde, there was a general question as to what we could do for rainforest protection in Germany. Should we take political influence, or should we limit ourselves to reaching the German climate goals? If I can answer in English, of course you can.
Okay, so basically right now we are having a special situation with our president. So there is no political will right now. Before we did have some security on the Amazon. We did have some influence with other non-governmental organizations, and we managed to secure part of the Amazons. But right now it is an open field for mining, farming, and deforesting. Right now, the only thing you could do from Germany would be just to have some political or diplomatical pressure on our president. That's the only way right now that we could impede this, because we have to think about that there are bigger companies that are interested in eliminating the Amazon right now. For example, Canadian mining companies are the ones that are mining in the Amazon. So if the Canada government actually did something about it, it would actually improve our situation. But that's what I would say. Some political pressure from Germany to the Brazilian government would be one of the solutions. And of course, being active here in Germany, it's important for all of these small countries and for Brazil. At the end of the day, it's the bigger countries like Germany and the United States that need to have climate neutral economies for the entire world to improve on climate change.
I think that's a very, very important point that you're pointing to, that we need to be courageous in having very ambitious targets in our work because of us, but also because of you, because you suffer directly the consequences right now, and we have to turn around. And we have to be ambitious. That's why it is so great that we have an example where students start to look at how do we get a huge...
So how can we make it possible to make a new building climate neutral? How do we get politicians and all the others on board to make sure it's a must, otherwise we'll fail to meet our responsibility? There was a question coming in to Stefan and Feline about this new building, how far you have progressed in terms of the procedure, because 2022 isn't such a far into the long way into the future, and how we could support you in this process. Well, I can try and start this. In principle, we don't know many things. Planning is still underway. Lots of things are possible. Otherwise, we wouldn't be working so hard as we are, because it wouldn't be very efficient unless we could still make a difference. But we can make a difference because planning is at the early stages at the moment. And of course, we can use your support. I don't know whether KLUG can contribute by maybe putting us in contact with certain important people. Of course, we are active locally as a local group, and we have online conferences. We're always glad about new people who want to join us, and maybe there are some tasks which can be distributed and attributed to newcomers, so would be pleased. I think an important point is that we create networks with political parties and key people in political parties. There is a lot going on there. It's not very deep yet, but lots are going on. We should discuss it, and also discuss where new buildings for hospitals are being planned and how we can tackle this. and maybe also have a discussion with the environmental ministers or the German health ministry, so that we use all kinds of channels to put this on the top of the agenda. There were new buildings which cost a lot of money, that they should be green and climate neutral. So maybe we should discuss this again and see whether we can create a network. And if people are listening, and maybe they could ask their hospitals what the planning stages are for certain new buildings, then sometimes we can have a web meeting and collect what's going on. But the main work has to be done locally, of course. But how can we support this? How can we coordinate? I would like to make one further remark, because we also built new buildings in Münster. Of course, when it comes to climate neutrality of new buildings, there was always the issue. Well, the best thing to do is have an enclosed system, passive building. And we've discussed this a lot, which this would mean that windows cannot be opened, especially in psychiatric hospitals. It's important to be involved in public life, because if the window is closed, you will not hear the birds sing, you will not smell the rain as it falls on the street. So it has an impact on well-being and mood and so on. And in the questions list, there was a question which asked whether more energy would have to be expended for cooling rather than heating. This is also a subject we've looked at very closely. And in Lengerich, for example, we are planning a new building, and here we're going to decide for underfloor heating, and there will be more underfloor heating in order to make sure that we can also cool down the building at summertime. Other my colleagues from Ralf, Annette, do you have questions of each other? Because then we can start discussing. Well, I would like to make a comment, really. It's about the Healthy Recovery Program, which will have been signed by 40 million doctors and health professionals. How should the world after COVID-19 look like? In Germany, 285 billion are going to be spent on that. On the EU level, 750 billion euros are going to be spent on that. And the question is, what kind of infrastructure will this investment go to? And we have studies by Joseph Stiglitz and Nicholas Stern, head economist of the World Bank. And the clear message is the biggest factor is converting the existing building stock. It's not new buildings, especially when it comes to employment. Of course, situations will differ in Europe, but converting or refurbishing buildings will be good for climate protection, also good for climate adaptation. And here we have underfunding nearly everywhere, also in the health sector. Campbell is the head of the WHO working group, and we got the task to go to the World Climate Conferences in Katowice and Madrid, and he clearly said that there is massive underfunding in the health sector, both in terms of climate protection and climate adaptation. So where the government subsidies are necessary. So I think these examples from Münster and Lengerich are great. I think they also show how far you can make progress if you get committed, and also where the road leads us. It's important to take this first decision, which side you're on. Are you going to be part of the solution or part of the problem? And then you'll find allies. But the decisive question when it comes to building or construction work is the existing buildings, because we can't tear down all the buildings in Germany. We need to refurbish them, as we need to have to refurbish society. Well, to add to that, we're going to get a presentation by Christian Schulz from TU Munich about the zero emission in the health sector by 2035. And if we demand this goal to happen and put this on the agenda as you do. But if we set this as a goal, if the Federal Chamber of Doctors does that, if we put this on the agenda at many places, then we have better chances of this topic being discussed. And then we'll get the wind behind us, and then we will bring what other people have pioneered to fruition, and to really provide examples which should be followed by everyone. So it's crucial to learn locally about who are the players, who are the contact persons. And if you can't make progress in one channel, then you should use the other channel. It's an important process to learn that. And then we also should interconnect each other so that the topic is on the agenda and can't be removed from there. But for that to happen, we need examples. We need groups like you in Hannover or in Munich, as we'll discuss next time with Christian Schulz. Well, since you mentioned that Christian Schulz will speak next time, I would also like to mention the other speakers, unless there are other remarks from the group or discussion points. So first of all, let me thank everyone for their valuable inputs. It's been great again, and I'm sure listeners have received lots of great examples and food for thought, and examples of what is possible if you get started. You simply have to get started somewhere. So next time we'll have Christian Schulz, who is an anesthetist who's working at the hospital in Munich, and he advocates the phasing out of destructive anesthetic gases. But we'll also have Dirk Messmer, who is the chair of the Federal Environmental Agency, which is the agency which reports to the Environment Ministry in Germany, and it specializes on environmental pollutants and effects on health. And Markus Springmann was the whole main author of the Lancet EAT study and researches in Oxford. Nicole de Paula researches on planetary health at the IASS in Potsdam, which is an institute for transformative sustainability research. So please drop in again next time, and also drop in for the 9th Academy, because that's going to be the final celebration to really wind up the whole series with important people. So please pass the word to people who haven't participated so far, and visit us again. And so much for my last words, basically. And so I'll leave you to the evening. Enjoy the evening, and thank all the speakers.